You're watching Iowa Live. Everything local, entertaining, and meaningful in Central Iowa is right here on Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and a smile is on my face because the guy sitting right next to me is smiling just as big. It is Dr. Josiah Fitzsimmons from the Vero Health Center. Hello, Dr. J.
Hey, Lou, thanks for having me.
Now, we've been on this program. We've talked about neuropathy and how Vero can treat neuropathy. We talked about knee pain and how they can eliminate your knee pain. But there's something else that is affecting so many people, and somebody in this room was affected with it as well. It's sciatica. Explain what that is to people. If you've never experienced it, congratulations. But
Yes.
if you have, you know what it is. But explain what this is.
Yeah, your sciatic nerve is the largest nerve actually in the human body.
Oh, I didn't know that.
Your low back, down into your hips, down into your legs, and it branches off into different parts of your body. So depending on what part of your nerve fibers is affected, it could have sciatic pain down into the front of your leg. You could have sciatic pain down the side of your leg, down the back of your leg, into your hips. Some people all the way down into their feet. And so it's a sharp shooting pain when that nerve is compressed. So whether it be in the lower part of your back, you have hip misalignments, structural misalignments, but sharp shooting pain down your hips, legs, or lower back.
Yeah, and it is devastating. It is debilitating. It can put you down for the count.
Absolutely. So a lot of people have bulging, herniated disc,
Okay.
degeneration in their lower back, and that causes compression of that nerve. They could have structural misalignments or muscle tension, but those all cause compression of that nerve running down your hips into your legs.
Okay, so that's all comes into play here, and just pressure on that nerve causes the pain.
Oh, yeah, debilitating.
Now, the thing is there something you can do about that? Because a lot of times you say, I have to live with it, but is that true?
You don't have to live with it for most
Good.
people. Absolutely. You know, we want to do a full neurological evaluation. We actually measure at 1/10,000th of a degree all the different nerve levels in your spine to see where the nerves are branching out, where they're irritated, where they're inflamed. We do a full muscle assessment. It's like an EKG for your heart, but for your muscles, see where those muscles are too tight, where they're causing that extra tension on that nerve, causing that pain. We also do a full structural analysis where we measure 60 different points down to 1/100th of a millimeter to figure out exactly where that structure has misaligned down your hips, down into your legs.
Really?
And so we want to figure out exactly and pinpoint the cause of that concern. Is it a structural misalignment? Is it a muscular inefficiency? Is it a neurological issue? Exactly what's going on to cause that sharp shooting pain down to the legs or hips.
Yeah, a lot of times people will try, you see it all over the place. Oh, you got to try these stretching exercises. That'll get rid of it. But that's just going to give you a temporary relief.
You're totally right.
Yeah, but you want to be able to get relief, period.
Exactly.
And live your life to its fullest without having to deal with this.
Oh, yeah, and we've had so many people, Lou, that have tried so many different stretches. They've tried medications, they've tried opioids, they've tried all sorts of different things. But at best, they just get temporary relief, masking the condition. A lot of people have turned to ablations where they're literally burning the nerves off in your lower
I've heard
back.
of that, yeah.
And a lot of times that only lasts for maybe 6 months, and then your nerves actually regrow and come back. And it's just a continual cycle of trying to manage the pain. But we want to figure out what's causing it and get some results.
So what do you do in this type of situation?
Absolutely.
How do you do this?
Well, first thing, Lou, like I said, we have to do those full neurological evaluations. We have to do that muscle assessment. We have to do that structural misalignment because we need to figure out exactly individually is for each person. It could be a structural issue. It could be a neurological issue. It could be a muscle issue.
Okay.
It could be an inflammation problem. You know, there are all sorts of different causes that could cause that sciatic nerve. And like I said, is it going down the front of your leg, the side of your leg, the back of your leg? That gives a different indication of what nerve roots are caused. And then we want to come up with an individualized protocol for each person that comes in. We want to improve the blood flow. We want to recreate the coating around the nerve. You know, if you have issues with deterioration of that nerve as well, we want to get the structural corrected. So we come up with an individual comprehensive game plan. Right now we have over 30 people a week that are coming over 2 hours one way to our clinic. We just had a lady come to our clinic for sciatic pain who'd been to Mayo Clinic. She's from Cedar Rapids. She couldn't figure out results. She'd been suffering with it for over a decade.
No way.
She couldn't tie her own shoes. She'd resorted to just having slip-on shoes for the last decade.
Yeah.
Yeah, all these different accommodations she felt like she had to make because she couldn't get it figured out. Within a few weeks, she got relief. Within a month, her pain we'd gotten totally corrected, and she hasn't had any issue since.
Folks, this is the kind of results that we're talking about. How many people out there just related to what Dr. J said? You can't bend over to tie your shoes. Been there, done that, but you can give them relief. And there's a deal going on right now. For $37, you're going to be able to get evaluated and find out what you can do for them.
Absolutely. So normally $237 to get a full evaluation, see exactly what's going on, do all those different individual tests, $200 off for Iowa Live. It's really a no-brainer, Lou. Like I said, give us a call, 515-335-8376. That's 515-335-8376. If you've been diagnosed with a bulging, herniated disc, sciatic pain, back pain, pain down in your hips into your legs, give us a call as soon as possible because you don't want to just keep living with that pain. We want to get your life back. We got nicer weather going on. You want to be active. You want to be mobile. But that's just not the case when you have sciatic pain.
Oh, yeah, you can get rid of sciatic pain. Vero Health Center can get rid of your sciatic pain. 515-335-VERO, V-E-R-O. Say goodbye to your sciatic pain and say hello to living your life to its fullest.
That's
Thank
right.
you so much, Doctor.
Thanks for having me.
When we come back, we're going to talk about seniors helping seniors and why having a sense of purpose is so important when we age. That's when we come back.